Well, a new minimally invasive heart procedure is now available in Arkansas for the first time, offering hope to patients who previously had few treatment options.
In tonight's Health Check report, how one woman says it gave her a new chance at life.
For Janine Lunsford of Melbourne, simply breathing became a struggle. After her heart stopped in 2017, she had a pacemaker implanted. But last year, she began losing her breath and retaining fluid.
I felt like somebody was holding my head underwater. I was drowning. I could not breathe. I was certain many times, this is my last breath, I'm going to die.
She had a leaking tricuspid valve. Her cardiologist referred her to Baptist Health, where doctors offered something new, the TriClip transcatheter repair system, now available for the first time in Arkansas. For years, patients like Janine had limited options.
We really didn't have any interventions for the tricuspid valve. A lot of this was either we treated medically, which was very difficult to treat, or we had to treat it with surgery, and that's open heart surgery.
Instead of opening the chest, doctors now insert a catheter through a vein and guide a clip to the heart. It's a two-physician procedure with one goal.
Dr. Strobel and myself advance a catheter device through the femoral vein up to the heart, and we use this device to sort of steer the clip system down onto the valve and then grasp the leaflets of the tricuspid valve to sort of cinch it together to make it leak less. The goal is to make people feel better, get their life back, and live longer.
For Janine, that goal is already a reality.
I'm able to do cardiovascular with no problem for 20 minutes, and I'm able to do things that I was not able to do before.
She says she has her energy back and her independence, and now with this procedure, patients across Arkansas have that same chance.
And chronic fatigue, swelling in the legs, and persistent shortness of breath are all symptoms of a leaky tricuspid valve. If you experience those, contact your healthcare provider.